diet was carried out by Dr. María Eugenia Jaramillo Flores, Samantha Alejandra Real Sandoval, and Gustavo Fidel Gutierrez Lopez. Okay, as you know, around the world, one of the main problem is the prevalence of overweight and obesity. Around 1.9 billion overweight adults and more than 650 million of obese people. In Mexico, the direct and indirect costs of obesity are increasing, as well as around the world, as you know. Obesity is a complex chronic condition of multifactorial etiology that develops due to an imbalance between the ingest of energy and the energy expenditure caused by sedentary lifestyle and ingested the excess of lipids and carbohydrates. Abnormal excessive accumulation of energy in the form of fat in adipose tissue. Risk factors that increase the likelihood of cardiovascular disease and diabetes, including abdominal obesity, hyperglycemia, or insulin-resistant dyslipidemia, and high blood pressure. This is related to the functional and structural adipose tissue. You can see in this slide the different types of adipose tissue: slim with functional and normal metabolic, where there's no inflammation, there's metabolic control and vascular function adequately. When this changes to obese with mild metabolic dysfunction, you can observe increase of inflammation, reduce the metabolic control, and vascular function is start to malfunction. When you can change to obese with total metabolic dysfunction, you can see a very high increase in inflammation, reduce the metabolic control, and reduce the vascular function. You can see the different types of macrophages in the slim adipose tissue. You can see the M2 macrophages. While you change to obese with metabolic dysfunction, mild or total metabolic, the phenotype of these macrophages change to M1. This causes the increase of TNF-alpha, interleukin-6, and PA1, MCP1, and increase the leptin-2, and decrease the adiponectin property. One of the effects of the increase of the adipose tissue is the development of non-alcoholic fatty liver disease. This caused by increase the fatty acids, the inflammatory cytokine, reduce the adiponectin, and increase the insulin resistance in the liver. This cause the changes of the functionality of the liver and promote the steatosis, non-alcoholic steatosis, liver cirrhosis, and the final is cancer or death. For that reason, it is recommended to increase the consumption of fruit and vegetables, because in these fruits and vegetables we can find, it's a very good sources of flavonoids, including one of the flavonoids that we are studying is kaempferitrin. And here in Mexico, there are many people who used to bad circulation, varicose vein, blood pressure, skin rash, pamphlets, sores, spots, kidney infection, syphilis, nervous, insomnia, and antibacterial and antiviral disorders, bronchitis, and trait to cancer. There are several studies around the Justicia Spicigera. For example, in the Journal of Ethnopharmacology, you can find the antihypertensive effect. And the aim of this work was to present or to evaluate the effect of Justicia Spicigera and kaempferitrin on the regulation of proinflammatory and anti-inflammatory cytokines in liver. First, we did the characterization of Justicia Spicigera, the antioxidant capacity, the composition, and the identification and quantification the phenolic compounds. The effect of Justicia Spicigera and kaempferitrin in obesity, we use animal models induced by, with obesity induced by food. We measure body weight, arterial pressure, body fat composition, lipidic profile, glucose level, adipokines modulation, and mRNA expression modulation. For this, we use male Wistar rats. The study during 4 weeks, and previously we maintained the animals in metal cage with sanitary beds under controlled conditions of temperature, humidity, and light dark cycles of 12 hours. Food, free access to water and food, and they are one group with a standard diet and the other groups with a hyperlipidic diet. We administrate the study, the Justicia Spicigera and the kaempferitrin for 8 weeks in a water base mixed with trim 80. And the euthanasia with sodium pentobarbital, 32 milligrams per kilogram the body weight at 8-7. We have 4 groups, the standard diet, 1 group, high-fat diet, with hypercaloric diet, kaempferitrin with hypercaloric diet, and hypercaloric diet más Justicia Spicigera. We determine 3 times a week, we determine the body weight and the body pressure, the blood pressure determination with plethysmographic methods we did at the end of the study, previous to the euthanasia. We did extraction on mRNA from liver tissue, and we did the RT-PCR for the different biomarkers. We did the statistical analysis, and these are the results. The different components of Justicia Spicigera were carbohydrates, 38%, fiber, 35%, proteins, 13%, ash, 8.6%, mixture, 2.4%, and lipids, 2.1%. We evaluated total phenolics as a gallic acid equivalent and measured the antioxidant activity by ABTS and ORAT. We use a phenolic extract of the phenolic compounds. We use other extract from water and from chloroform. These are the results about the total phenols. The main components or main phenolic compounds come from water with a highly hydroxyl groups and followed by the ethanolic 80% extract. The main antioxidant activity was detected by ORAC because this is a very sensitive antioxidant method. We found the main compound kaempferitrin in Justicia spicifera in the extract, ethanolic extract, with a concentration about 1.67, very similar to the previous study by Ortiz-Andrade et al. We made the characterization of chromatograph of ceton extract of Justicia spicifera, and then we can find several carotenoids present in the plant, where the results about the gain of weight, which obtained that obviously the group with high-fat diet was the group with the higher gain of weight, followed by the group treated with kaempferitrin and then with Justicia spicifera. The main reduce of corporal weight was the Justicia spicifera plant. In the case of the content of lipids of adipose tissue, obviously too, were the high-fat diet, followed by kaempferitrin treatment, and then Justicia spicifera treatment. The main reduce of adipose tissue found in Justicia spicifera group. There are important reducing body weight, and the consequences reduce the risk of chronic disease like coronary heart disease and hypertension. In the case of energy consumption, we find the more consumption was the high-fat diet, followed by kaempferitrin treatment, and followed by Justicia spicifera treatment. This, as you see, Justicia spicifera treatment was the most effective in reduce the energy consumption. In the case of glycemia and insulin resistance, we obtained that the best treatment was Justicia spicifera plant, and we don't found any difference between the kaempferitrin treatment. Kaempferitrin is a flavonoid which we found, as you see, in the higher concentration in the plant. The lipid profile due to treatment with Justicia spicifera and kaempferitrin were the following. Cholesterol total, you see the increase of the group of animals with high-fat diet, followed by very high increasing with kaempferitrin, but a small reduce with Justicia spicifera. HDL cholesterol, the important reduction with high-fat diet, in a group with high-fat diet, and increase in both with the treatment with kaempferitrin and Justicia spicifera plant. LDL cholesterol, an important increase in high-fat diet as we expected, and an important reduce too in the treatment in the groups with treatment with kaempferitrin and Justicia spicifera plant. What about the effect on blood pressure? About the effect on blood pressure, we found a very good result with kaempferitrin and Justicia Spicigera plant, both reduced to compared to the obese group, and both type of systolic blood pressure and diastolic blood pressure. Both have an important reduce of pressure. In relation to adipokines, adiponectin and leptin, we found that in the case of adiponectin are reduced in the high-fat diet group, and in an important increase in kaempferitrin flavonoid present in the plant, and followed by there are no difference when you use Justicia Spicigera plant. In the case of, sorry, this is adiponectin, this is leptin. In the increasing of levels of leptin characterized by the obese group, and there's no difference between the kaempferitrin group, but an important reduce of leptin levels when we use Justicia Spicigera plant. In this case, it's important the reduction because leptin inhibits the expression of leptin and promote the expression of pro-inflammatory cytokines, but otherwise the adiponectin inhibits the expression of pro-inflammatory cytokines. The effect of Justicia Spicigera and kaempferitrin on the high-fat diet animals, of the treatment of high-fat diet animals, you can see the important reduction of TLR4, an important protein factor that promote a very high inflammation. And you can see this, what is the happen when we increase the free fatty acids around the cells, or in excessive in liver tissue. The fatty acids is the ligand of TLR4 and promote the expression on FFKB, that is a transcription factor to induce the production of interleukin-6 and TNF-alpha. As we remember, the obesity is an inflammatory status and produces different kind of pro-inflammatory cytokines, and the kaempferitrin and Justicia Spicigera reduce these important transcription factors that induce the pro-inflammatory status. In the case of the TNF-alpha, inflammatory protein, the group with high-fat diet increase the levels of TNF-alpha, and both treatments with kaempferitrin and Justicia Spicigera reduce the levels, but the most important reduce was with Justicia Spicigera plant. These are the signaling pathway that we can find when the TNF-alpha form the complex with other proteins to induce with the NFKB factor, transcription factor, to produce many other proteins, pro-inflammatory proteins, like interleukin-1, interleukin-8, and other more. The use of kaempferitrin and Justicia block this signaling pathway, and we obtain the anti-inflammatory response. In the case of NLRP3, important complex of proteins pro-inflammatory, we obtain a very high levels in high-fat diet, but again, the treatment on kaempferitrin and Justicia spicifera reduce the levels of NLRP3, and in the case of caspase-1, you can see that in Justicia spicifera plant reduce in important way the caspase-1 that is related to the activation of the pro-inflammatory signals. These are the signaling pathway when we use a high-fat diet, and in some way this kaempferitrin and Justicia spicifera inhibit this formation of the complex of proteins that induce the pro-inflammatory proteins. Other pro-inflammatory proteins like interleukin-18 and interleukin-1 beta, both reduce in both cases the expression of interleukin-18 and interleukin-1 beta. In these cases, reduce almost at the normal level, and in these cases, reduce a very important percentage. This is the same signaling pathway that used to produce interleukin-18 and interleukin-1 beta that is the responsible for the low-grade inflammation in obesity. In the case of the PPAR gamma and SREBP1C related to the synthesis of lipogenic signaling, we found no difference between the high-fat diet and standard diet, but anyway, kaempferitrin and Justicia spicifera reduce in important percent the PPAR gamma. And in case of the SREBP1C, obtain a very important reduce of this protein in Justicia spicifera, this mRNA expression. We measured the PPAR alpha 2 that is related to beta oxidation, and UCP2, what is related to antioxidant activity. If you see the important reduction in the high-fat diet group of the beta oxidation of the PPAR alpha protein that induce beta oxidation, but the treatment with kaempferitrin and Justicia spicifera, there are an important increase of this factor. In the case of UCP2, there are a very high increase in high-fat diet, and the kaempferitrin and Justicia spicifera reduce this protein in the liver. There are several reports that mention that flavonoids stimulate PPAR alpha, decreasing steatosis by activating beta oxidation of fatty acids. This is the global results of the study. Here we show the downregulation on mRNA and upregulation of mRNA. Red is kaempferitrin and the violet is Justicia Spicigera plant. We see that both both reduce TLR4 and both reduce NLRP3 caspase-1 only by a Spicigera plant, and both reduce interleukin-18 and interleukin-1 beta, the TNF-alpha, and UCP4, avoiding to produce ROX. All of these are the proteins related or promoted by high-fat diet to pro-inflammatory status in obesity. The conclusions are both treatments lower blood pressure, and regarding to lipid profile, Justicia Spicigera decrease the concentration of triglycerides, and the two treatments increase the concentration of HDL cholesterol. The hypercaloric diet increased expression of all of the pro-inflammatory proteins, and the high-fat diet, when the group treat with kaempferitrin or Justicia, were able to down-modulate all these pro-inflammatory proteins. Kaempferitrin and Justicia treatments downregulate PPAR gamma expression while overexpressing PPAR alpha. Regarding XRBPL, only Justicia Spicigera modulated the transcript down. Kaempferitrin and Justicia Spicigera powder treatments have a regulatory role in the transcriptional expression of the genes involved with inflammation in the liver, which could suggest a suppression in the levels of the corresponding proteins. So they can be considered as potential candidates for the treatment of inflammatory disease, such as those involved in obesity. This is the reference. Many thanks.
Thank you, Dr. Maria, about your presentations. It's an excellent presentation. So anyone have questions and inquiries to Dr. Maria, feel free to ask her.